right, good afternoon. I'm SanGiovanni, and I'm here to talk to you about a research study I did over the past year, children's consumption of juice and sugar-sweetened beverages, and looking at whether parental knowledge of the AAP guidelines on juice intake, as well as parental consumption, makes a difference with this. So this all started actually when we have our community pediatrics rotation with Dr. McGillner. In the very beginning, we sit down and talk about some of the projects that we'll do over the month, and we use obesity as like our platform with coming up with ways that we can be an advocate for our patients, as well as thinking about ways that we can tackle childhood obesity, since it's such a big topic. As you can see here, there's so many contributing factors, and I noticed as a resident when I was seeing my patients, I was constantly overloading them with all the recommendations that we make as doctors is how to prevent obesity. So, you know, decreasing your juice intake and make sure that you're active and making sure that you're not watching TV so much. There's just so many recommendations that we do at every visit, and I felt that I was overwhelmed with it, and I'm sure my patients also felt overwhelmed. So when we sat down and talked about it, we thought, what's one little thing that we can do that would tackle this big problem, and what's something that we can address? And we settled on juice and sugar-sweetened beverages. So I started with a lit review and found that actually children's consumption of sugar-sweetened beverages and 100% fruit juice has increased significantly over the past couple of decades. And along with that, we all know so has childhood obesity. Increased consumption of sugar-sweetened beverages is definitely associated with being overweight and obese, and it's also associated with adverse effects, as we know, dental caries, hypertension, cardiovascular disease. Limited success with interventions at school. There's been a lot of studies looking at programs where they go into the schools and educate the children, but it's actually thought that it hasn't really had any long-term effects, and this has led a lot of people to think that parental influence is actually can have the biggest impact and actually help with changing children's habits of what they drink. And there's actually, though, very limited studies looking at the impact of parental practice and their knowledge of what children should be drinking. So this actually all, I was thinking about these ideas all at the same time that Mayor Bloomberg was actually proposing his ban on banning sugary drinks larger than 16 ounces. And the Board of the Board of Health for New York City actually voted for this ban in September of 2012. Later on, there was a Supreme Court judge that actually had vetoed this in March of 2013. But I think either way, Mayor Bloomberg got most of New York City thinking about what they were actually consuming every day. And as a result of this, there was actually these wonderful posters that were posted all around the city. I know some of you probably saw it on the subways, basically showing people that what they were drinking really has lots of sugar in it and is really not good for them. And the one below I really like is it shows you how long you would actually have to walk in order to burn the calories in 1 can of Coke. And I think these were great educational posters throughout the city, and it made me think about what we could do for our patients in our clinic and how we can hit home the point with limiting juice and sugar-sweetened beverages. So when I started this study, we wanted to evaluate the parental knowledge of the AAP guidelines for juice consumption and quantify children and parents' consumption of juice and sugar-sweetened beverages. And those of you that might not know, the AAP actually recommends that children drink no more than 6 ounces of juice if they're up to 6 years old, and then if they are older than 6, no more than 12 ounces. And then we also wanted to implement educational interventions in our pediatric clinic in order to improve parental knowledge of juice and sugar-sweetened beverages, as well as the patients if they were old enough as well. So for this, we asked parents of children between 2 and 12 years old that were seen regularly. We wanted to make sure they had definitely been to our practice before and would probably be coming back in our residency group practice in East Harlem. We completed a survey asking them about their child's daily habits of drinking juice and sugar-sweetened beverages, as well as the parents also their own practice of drinking juice and sugar-sweetened beverages. We actually asked parents about the AAP guidelines. Basically had 3 questions. We said, do you know if there's a limit on that the AAP has set on juice? And if so, how much juice should a child drink if they're less than 6 years old, and how much should they drink? What's the limit if they're over 6? So it was only 3 questions. And then after the surveys were completed, we gave parents pamphlets on juice and sugar-sweetened beverages, which I'll show you in a little bit. We hung up some posters that we had created in the clinic, and we offered some workshops on juice and sugar-sweetened beverages that would be held for parents and for children. We did a t-test for data analysis. So the data collected, we also collected demographic data, child's age, height, weight, BMI, again, how much juice and sugar-sweetened beverages on average that they drank per day, as well as where they were drinking these beverages. We, again, assessed the parents' knowledge of the AAP recommendations, and then also asked parents, how willing are you to make these changes in order to improve your child's habits, and what would be helpful in making these changes? So these are our results. 52 parents completed the survey. And as you can see here, the ethnicity breakdown, we have 50% Hispanic, 38% African American, 8% mixed. This is very representative of our clinic in our resident clinic in East Harlem. Also the education, there were a number that actually didn't give an answer for this, but it was pretty well distributed with some high school all the way up to bachelor's degree and then just 2% for graduate degree. As also with the breakdown in ages, we asked parents that had children between 2 and 12 years old. You can see 2 to 4 years old, there was 32% that had completed it, probably due to the fact that if you're between 2 and 4 years old, you're probably seen in our clinic a little bit more frequently. But then as you get a little bit older, it's distributed a little bit equally, except for the 10 to 12 years old. We would have liked to have a couple more of them, 3.8%. So we looked at the children's BMI of the parents that completed the survey. And as you can see here, if they were more than 85 percentile, they're considered overweight. And then the, more than 95 percentile, they would be obese. And about 40% of our children are considered overweight or obese. Haynes data that was from 2009, 2010 actually estimates that 30% of children are obese, but then if you look specifically at African American or Hispanic children, it is 40%. And interestingly, our clinic, we had 40% that were obese, and most of them were Hispanic or African American. We broke down how much children drank with 0 to 2 servings and then more than 2 servings. So if they were 0 to 2 servings, they were considered a low juice or sugar sweetened beverage consumer. And if they were more than 2, then they were a high juice sugar sweetened beverage consumer. And then we also broke down how much parents drank in the same way. And then further down, you can see the parents' score and the knowledge of the AAP juice limits. Most of these parents did not know the answers to these questions, with 71% not getting more than 2 of the 3 questions correct. So we looked at some of the associations that we found with this study. As you can see, over on the left-hand side, with children that are high consumers, out of all the children that were considered high consumers, the parents actually, only 12.5% of those parents were likely to pass the test, where the children that were low consumers, there was 42.9% of those parents that passed the test. So there was an association with parents that knew that there were AAP, knew that there were recommendations for juice limit and how much their children drank. And the p-value here was 0.03. And then looking at parents' consumption with children's consumption, you can see on the left-hand side of all the parents that were high consumers, their children, there was 35.7% of their children were also high consumers, where the parents that were low consumers, only 25% of their children were high consumers. Then we asked them, where does your children drink juice? Basically, we wanted to get to the point of where would it make the most impact to do these educational interventions. It's obviously important to teach children whatever we can in school and to provide them with this knowledge, but we weren't surprised. This is what we thought. Actually, 90.4% of them said that their child drank juice at home, followed by a restaurant or fast food, and then school is the last thing that they chose. And then with sugar-sweetened beverages, there was actually more of them that drank it in fast food or restaurants, 69.2%, followed again by home, 42.3%, and then school is the last one. And we also asked them, did your physician discuss limiting juice or sugar-sweetened beverages with you at your visit? And it seems like this is pretty good. You would say 60% of our physicians actually do talk to their parents about limiting the juice and sugar-sweetened beverages. Some of them even said, you know, I don't know, so they could have mentioned it. However, it is part of our template for a well visit. It's right there to remind you to talk to the patients about it. So I think that this could definitely be better. And clearly, if the parents didn't remember and said, I don't know, then it must have not been that effective of a conversation. And then we asked them, are you willing to make changes to your child's consumption of juice and sugar-sweetened beverages? And overwhelmingly, 88% of these parents said yes, which says to me that these parents want to do what's healthy for their child. They want to do the right thing, but a lot of them might not have that knowledge in order to make those decisions. And then we asked them what you thought would be helpful in making changes. And you can see here it's kind of distributed over the 4 answers that we gave. The 61.5% speak with a nutrition, which most of us will do with a child that's obese in clinic. We refer them to nutritionists. Providing written information, we actually did do that with this study. Speaking with their doctor, we're trying to promote that with this study. And then attending a class, we also offered those workshops. So we use this as a needs assessment in order to see what we should do in clinic for our patients. So this is the poster that we came up with to hang up in the exam rooms at clinic. As you can see here, it's easy to understand. We use some of the children's favorite beverages so that they can relate to it and say, oh yeah, I love drinking Capri Sun. I drink like 5 of those a day. And then we also wanted to show them that there's the same amount of sugar in a can of Coke as there is in 12 ounces of apple juice. A lot of our parents feel that juice is healthy, they're doing the right thing by giving their child juice, but they're giving them plenty of juice, and we wanted to show them that it's just as much sugar in both, and actually the choice for your child should be water. And this is the pamphlet that we gave to them. As you can see, we have the breakdown of all the drinks again, so they can take this home and put it on their refrigerator, and as well as some recommendations of what we would like them to do at home, you know, offering water first, limiting the juice to only 6 ounces a day, and offering fruit instead of giving the juice. So for the parents that say, but I want to give them juice, it's healthy, we say, no, please give them a piece of fruit instead. So we also offered juice and sugar-sweetened beverage workshops. I was very excited about this, and what I had envisioned was that parents and children would be doing hands-on activities where they would be measuring out the amount of sugar that is in each beverage. We'd be talking about and having them taste alternative healthy beverages. We would be going over nutrition labels and teaching them how to read it and understand how much sugar was in each beverage. And then we were also going to have children's activities where they were also learning about healthy drinks and nutrition labels if they were old enough. So we had 3 workshops. We offered everything. We offered refreshments, babysitting, flu vaccines for all the children. And unfortunately, it really didn't go over well, and actually no one came. So this was me, because I was very frustrated since that was the one thing I was most excited about. So I remember sitting there when we were waiting for people to come for the last workshop, and no one was there, and so we all started brainstorming about what we could do in order to reach the parents, because we knew that 88% of them were willing to make changes. And so I really do believe that there's parents that wanted to make the right choice, and they just need that knowledge to get to them. So we were thinking, you know, they're in clinic so much, and we asked them to come back for these workshops. What can we do to make the most of their time while they're in clinic? And so we came up with our waiting room talks. Basically, we walk around with a cart, speak to groups of patients and parents just throughout the waiting room. We have them guess which drink has more sugar in it. We show them the amount of sugar in their favorite beverages. We make it very interactive. The kids love it. The parents are very interested. We hand out the pamphlets and the posters. And then we try to discuss as much as we can in the nutrition labels, but really try to hit home the point that they need to limit the juice and sugar-sweetened beverages. And it's actually gone, they've been very receptive to it, and it's doing pretty well. We're trying to get it into a regular curriculum where medical students can come and do it maybe once a week or every other week to go in the waiting room and do these talks. So the conclusions for this study is that we did find a significant association between parental practice and their knowledge of the AAP recommendations for juice consumption, and the limits on juice consumption and children's consumption of these juice and sugar-sweetened beverages. educating parents on the AAP recommendations, as well as targeting parents and helping them decrease their consumption of juice and sugar-sweetened beverages, could have an influence on decreasing their child's amount of juice and sugar-sweetened beverages. And this could hopefully decrease their children's risk of overweight and obesity. But we also learned educating parents can be a challenge, and we all need to be creative with reaching our parents with educational interventions that are convenient to them. So future research, I hope to do a post-intervention survey. We've had these posters and the pamphlets out now for about a year. So we're getting all the surveys together again to send it out to those 52 parents that completed it last year. And we want to see if there has been any decrease in the children's consumption of juice and sugar-sweetened beverages. Also more of like a quality improvement project. We want to know, do more physicians actually talk to their parents and to the patients about limiting juice and sugar-sweetened beverages? We have a reminder for them up in the exam rooms, and a lot of times when we're going in, the kids and the parents have already been looking at it and already talking about it. So we think that this definitely probably improved the rate of how our physicians are talking to our patients. And we also want to know, is the discussion more effective now that they have visuals in the exam rooms? We also, this was a very small study, 52 participants. So obviously larger studies are needed to assess these interventions and really look at whether parental knowledge and practice has an impact on the children. And does increasing parents' knowledge actually have an impact on their children's BMI? And lastly, as we started in the very beginning, can this help in our fight against childhood obesity? Thank you. Any questions?
This is obviously a program that you're providing to every patient that comes in. Is there a ratcheted up program when the obese child walks in that's any different?
There's nothing, as far as the pamphlets and the posters, we've done for everyone. Because we've actually even seen in pediatrics a lot of kids that are underweight, sometimes they're drinking too much juice as well and sugar-sweetened beverages, and so it can actually work the other way. So we've been kind of, it was just for everyone, no matter what your BMI is, you get the same sort of education. But it is a good point that if they're obese, maybe having a more advanced curriculum for them might be helpful.
Having been raised on juice, now that my wife, the pediatrician, yells at me when I give our kids juice, I'm just wondering, this wasn't the focus of your research, but historically, did the AAP say go out and drink lots of juice, and is this a pendulum swing in the other direction, or is it just something that we just never thought about before and realized it's a problem?
Right. I'm not sure if the AAP, do you know, Leora, when they...
I don't think the AAP ever said go out and drink a lot of juice. And the AAP guidelines, as Christine said, they don't actually recommend that you give juice. So they're not recommendations, they're guidelines. They say you should not give juice before 6 months, and if you are giving juice, not more than 6 ounces. So I don't think there was ever, I can't say 100%. I think the idea was, 100% fruit juice was preferable to Hawaiian punch, but I think from as far as I can remember, it was the AAP recommendations were always fruit. If you want the nutritional value, eat the fruit, don't have juice. And I think what's happened so much that I think we all see is that people sort of equate juice or even sugary beverages with nutritionally sound, that it's good, if on the Hawaiian Punch container it says if it has vitamins, somehow people think that this is good for the child.
Well, the advertisements for like V8 are they're just putting all the fruit in the container, right? So.
And a lot of times we have parents say that we get juice from WIC, so we figure that that's a healthy alternative, because why would they be giving me juice if I wasn't supposed to be giving that to our children? So I think they've gotten the message sometimes that it's okay it's a healthy thing to give them.
And the TV commercials also, I think, make it
that's
100%
true.
juice healthy, I think.
Does tomato juice count?
What's that?
Does tomato?
Yeah, so as far as I know, all different types of juice, because it still has lots of sugar. I think the tomato juice is more the sodium that we'd be concerned about, but either way, it's better to eat your fruit and vegetables than drink it, for sure.
And when I do have some patients that will, make smoothies and put if you're taking the fruit, you're putting it in a blender, that's obviously not what we're talking about.
Right.
But for all the all the commercially available preparations, ranging from apple juice, orange juice, to iced tea, Hawaiian punch, Capri Sun, iced tea. I mean, it's amazing. I think I'll just say, the posters that Christine made, having them up become this focal point where you walk in the room and you see the parent and the child talking, and the child will say, "Oh, but you were drinking that at dinner." And people will say, "Oh, it's just tea." I said, "Well, what kind of tea is it?" "Well, it's iced tea, it's nest tea, it's sweet, packed with sugar." People don't realize. So it's become this real focal point and a talking point for people in a way to engage parents and children. And I find, with the older children, just as often they'll point the finger at the parent and say, "Well, you buy it," or, "How does it get?" That's the other question. How does it get in the home? Right? With young children, it's the parents who are buying. So I find a lot of times, and we discuss this amongst ourselves, we're often counseling, and we're really counseling the parent about themselves. Because, they want it for themselves. They really have to stop that if they want their child to stop it.
Which is with this, it was more targeting the parents for the workshops and for the poster and the pamphlet. And they were the ones that consented for the study. It was really about educating the parents.
I guess my question is more in reference to what you're talking about, the future directions, et cetera. But I'm curious about the correlation between the obesity in the kids and the obesity in the parents, et cetera, which is more speaking to that. I spent some time when I was in medical school on the Navajo Reservation at the Indian Health Service hospitals, and there was a huge push for educating kids about sweetened beverages. However, there was also a big problem there with people just feeding kids too much overall, like lots of other things. It's not just juice, it's fry bread, it's all these things. And I guess my question is more, like, is just focusing on juice going to be efficacious in reducing obesity? I would think that a lot of overweight kids live in homes that have overweight parents, and it's not just sugar beverages, although it's a great intervention.
Absolutely. No, I agree with you. Just the first slide, there were so many contributing factors. And we actually did have a question on the survey that we didn't look at the association, but whether parents considered themselves overweight or not. We didn't specifically ask them about the BMI. But I agree with you. There's so many recommendations we can make for the parents and the patients in trying to improve their health. And this was just targeting one thing, but I think there's lots of things that we need to target and help them. And I don't know if changing just their juice and sugar-sweetened beverages will definitely have their weight come down. But a lot of times when I see my obese patients in the office, I pick one thing, like I tell them to just pick one thing that they're going to change, because if they make that a habit, then eventually they'll, when they come back, I'll ask them to pick another thing. And we usually see them about every 3 months as far as for weight checks and just see how things are going. And so I feel like otherwise it's just so overwhelming to tell them all the things they have to do. But I feel like if they pick one thing, maybe they can start to make changes, and maybe eventually that will decrease their BMI. But I think there does need to be they need to do a lot more than maybe just limiting the juice and sugar-sweetened beverages.
It's genius focusing on people that are in the waiting room like that. It's a captive audience. It's a good way to
thank you.
keep them interested.
I think it is overwhelming. And what I think we found was that we have sheets with all this advice to give people. Eat breakfast, 5 servings of fruits and vegetables. There's so much anticipatory guidance you can give about obesity prevention, and people tune out. And I think so the idea was to really focus. This is one aspect, and for different families, there obviously are other things you can say. But it is interesting that with some of our patients, they are drinking hundreds. After a while, I was quantified when I asked parents, they can be drinking, a little kid, 500 calories a day, just drinking. So it is one thing, and obviously also it has to do with our limited resources. We have an amazing, comprehensive obesity prevention and treatment program here, which we don't. We've been talking a different language, but these are sort of what interventions can we do with general pediatricians and residents in the practice.
Can you think of some interventions that are could happen between the times that they actually come to the clinic?
Well, there have been, the Adolescent Health Center actually like texts their patients with reminders to take birth control pills and reminders for appointments. And I know that I think Nita Van Japiran actually was also working on like texting for reminders as well. But that has been something that I've heard mentioned here and there, is that maybe texting them the reminders of not drinking that can of Coke or exercising today, or I guess that could be one way to reach them. And I would think that the school interventions at that point might also help in like supplementing, although the parents aren't getting that. And as far as other ways to reach them, I can't think of many other things besides having them come back to the office or offering them classes at the clinic. Everything requires them to come in for it. Seeing the nutritionist, they have to come back to. So it's tricky.
Great. Well, we are out of time. Thank you, everyone.